In April 2017, we launched a new initiative to test the concept of digital pathology across Greater Manchester. Digital pathology is part of the Vanguard series of work that we've been doing across cancer in Greater Manchester. The way we've done this is working with 7 trusts, 7 hospitals across Greater Manchester. The aim of the work is to see how we can work closely with the histopathology departments, in particular how we might be able to implement digital pathology in the future.
Histopathology is the examination of tissue samples at a microscopic level to determine what type of cancer is present and what type of features are present that will guide further treatment. Once we've looked down at the tissue at microscopic level, we're able to say what type of cancer it is and also what type of features the cancer is exhibiting. Histopathology then guides their future treatment. So, for example, whether the patient needs radiotherapy, chemotherapy or personalised medicine.
Fantastic work is being carried out on a daily basis in all the histopathology departments in Greater Manchester. The number of cases that we receive is ever increasing, and the challenge is how can we deal with the increasing number of cases and with the request for producing more complex reports, more complex opinions when there is a crisis in the workforce. There are not many of us, and there is the mismatch between resources and the demand. In order to test the opportunities that digital pathology can bring to the specialty in the region, we decided to launch the Digital Pathology Project.
When a sample arrives in the histology lab, the technical staff generally produce a glass slide with a very thin section of tissue on it. This would traditionally be looked at down the microscope. As part of the Digital Pathology project, we're using a high-resolution scanner and producing high-resolution images to replace that process of looking down the microscope.
My experience with the Digital Pathology project has been a positive one. The positives for me in particular have been the quality of the scanned images, the ease with which measurements could be done on the screens and on the tissue sections. It also offers a pathologist to be able to work smarter, to use technology and to be able to offer a diagnostic opinion sitting remotely. This, in my opinion, is going to be a very important use of digital pathology, especially in the current climate of a shortage of consultant histopathologists.
So I found that the Digital Pathology project has been very interesting. I think the greatest advantage is the connectivity it can provide. Because the image is digitised, it can be viewed by other people, so if we need a second opinion for a complex specimen, then it's easier to get somebody else to have a look at it, and they can look at it in real time with you. We can get feedback, so not only are we getting better diagnosis, but we're also learning at the same time. You also don't have the delay of samples being sent off to additional laboratories. They can look at them once you request that a second opinion is given, and it may not just be by one person, it could be a whole group of people, and in complex cases that can be a great advantage to ensure that the patient gets the treatment that they need in a more timely fashion.
Waiting for the results of a biopsy can be really, really stressful for a patient, especially if it has to be sent for a second opinion, in which case you have to double the time you have to wait. I remember when I was being treated, the waiting is the worst thing. Digital pathology will speed things up. It will decrease the anxiety for the patient because you can get the result of the biopsy to the patient much, much quicker. It has to be done speedily.
The project is now completed. During that period, 1,200 cases were uploaded onto the system using those digital pathology techniques. So I think that's a major achievement. And of course, we also get the feedback from the pathologists. How does it actually facilitate their work and how does it reduce their workload if it can? So all of that, I think, has been very positive and very helpful. And I hope that we can now move on to the next step of implementation in the sort of real world rather than in a particular Cancer Vanguard project.
This project has been a proof of concept, we have demonstrated how the technology can be an enabler for collaborative and more efficient ways of working and potentially coping with the increasing challenges in histopathology.
One of the key things for the Vanguard is to test new ideas and new initiatives in cancer for our patients. And we've been able to do that with digital pathology. And we now feel that we've got a proof of concept, and we think this is replicable both across Greater Manchester on a wider footing and also across England as a whole.